I think that the structure of our program is strong in providing a reasonable start with our didactic information kind of loaded up front, preparing the residents so that they have some of that information, and then our faculty really tries to do a good job at supporting that material through the program's timeline.
So being a level 1 trauma center means that we do see a higher complexity and acuity of patients that do suffer from traumatic injuries. So we provide care to the underserved as well, and I think that provides a experience that's both a privilege to be able to provide services to the underserved community and those that don't have the benefits of certain healthcare access as well.
We're lucky enough to rotate through 3 different clinics, and we see a wide range of patients and pathologies. One of the sites is far more post-op centered, while one of them is more focused on chronic pain and psychologically informed practice, and there's a lot of motivational interviewing. But I think one of the strengths of our program is the diversity in our patients.
And the complexity level is really nice to be able to develop a realistic real-world skill set to be able, outside of that exam, to meet the needs of complicated patients once you finish the residency and put yourself in an upper echelon in your skill set in treating patients with complex problems.
First of all, U of Health in Jacksonville is a teaching academic center, and that really sets us very different from many teaching environments, especially for PT residency training.
We have 45-minute one-on-one treatment sessions with our patients, which is very important.
Some of my friends who have done residency programs elsewhere, I know they don't treat one-on-one for 45 minutes, which is one of the reasons I love this program. And this facility as a whole is we really value one-on-one patient care. And I feel like that just really helps you build a bridge with your patients. It gives you plenty of time to work with them and really just build those relationships.
Part of being an evidence-based clinician, a big piece of that pie is taking the patient's beliefs and preferences into consideration. And I think the culture at U of Health Jacksonville really pushes us to be patient-centered and really make patient beliefs and preferences a big piece of that pie, and nothing is ever cookie cutter here.
From attendings and to our program director and coordinators and to our site leaders, and we're all very humble, very supportive to each other's work, and also very supportive to our residents.
From the residency leadership, they're always there for us. I know they've personally pushed meetings around to make time for us, so they definitely prioritize the residents, which is greatly appreciated.
I would say mentorship is probably the greatest strength of this particular residency. Our mentors are very diverse in their backgrounds and their techniques, styles of treating, which is awesome because we do not turn into a clone of one single mentor. After spending a year with them, instead, we get to take bits and pieces or different tools from each of them.
The ideal resident is someone who is hungry to learn. It's a very interactive process, and someone who's willing to be a collaborator, is willing to step outside of the normal boundaries. You know, we're in a profession, we're not in a job, we're in a profession, so willing to kind of step outside the boundaries.
Very driven, and then having clear goals for their career, and also well organized from their personal life, but also professional life, and then humble to learn. You
know, we graduate PT school and then you kind of come in as a generalist, so you sort of know a little bit about a lot of things. But after this, I feel it's definitely a lot more confident orthopedics. Like I know my stuff. Man, they set me up to be a lifelong learner. Just really kind of instilling like you're never done learning. And I feel like that's just really valuable because you can get stagnant if you just like, I know my stuff, I'm good, I'm done. But you really gotta, keep pushing yourself, keep challenging yourself.
Jacksonville's a great place to live, to work, to learn even. It's a big city. We have a lot of, we're a medical hub, we have a lot of healthcare organizations to provide healthcare services to our community and those in the surrounding areas of the region as well.
In my time down here, I've tried to take full advantage of the golf courses, the beaches.
We're an active community, so there's always some sort of event or run or expo that really helps us support the community that we live in, and we love to get involved in that as well.
You should do your residency here because we have an excellent program with learning tailored to the individual resident, and it's a supportive environment, and you have a lot of opportunities to learn here.
You should do your residence here because it's a great facility. Like I said earlier, one-on-one treatment times is fantastic. You have great mentors. Organizationally, it's fantastic. And just the communication and interprofessionalism between different departments is what sets us apart from other places.
I think that the residency programs, and specifically here at UF Health Jacksonville, really sets you up to be a clinical leader, to be someone that is able to provide excellent patient outcomes and excellent care to the patients, but also be in a role where you're able to provide mentorship and be a resource to those that are aspiring to grow and better their clinical skill as well.